My name is Bharath. I'm a hematologist and oncologist here at Humber River Health, and I see patients with blood disorders, including thrombosis or blood clots. So the word thrombosis refers to blood clots, and these can happen anywhere in the body, the legs, the lungs, the arms or neck, and even in the brain. So a DVT, which stands for deep vein thrombosis, is a type of blood clot or thrombosis, which typically happens in the lower legs or the upper legs. Usually we see it happening above the knee in the thigh area. DVTs can also happen in the upper extremity, which is the arms, but more commonly they're in the legs. So in terms of signs and symptoms of a DVT, we typically see one big red hot swollen leg is what patients often feel. So one leg compared to the other would be a lot more swollen, particularly from the thigh down or the knee down. In terms of how it's treated, so the primary treatment for DVT is blood thinners or anticoagulation, and these are used to treat the blood clot for usually 3 to 6 months, but sometimes longer depending on each case. So as with anything else in medicine, prevention is always really important. So to avoid or minimize the risk of developing blood clots, there are a few things we often suggest. One that helps keep blood flowing and pumping is mobility. So moving around, being active is always helpful. The second thing, of course, to minimize the risk of developing a blood clot is to actually be on a blood thinner. This is only for people who have developed a blood clot and are on a blood thinner for prevention. That's something we use as not just treatment, but prevention to get another blood clot in the future. So here at Humber River Health, we do have a thrombosis clinic, which specializes in assessing and managing patients with blood clots or thromboses. So this occurs in the medical daycare. It's on the second floor of the hospital. We're actually standing outside it right now. It runs typically Tuesday, Wednesday, and Friday. It's staffed by our wonderful receptionists and our very dedicated nursing team. And we help to see these patients and treat them for their blood clots with blood thinners.